certified healthcare provider for personalized advice and diagnosis.
Great to have you with us. We are talking health on the show this afternoon. And March is Colorectal Cancer Awareness Month. This is the third most common type of cancer worldwide. So highlighting the importance now of screening, promoting a healthy lifestyle to decrease your risk of developing cancer of the colon, rectum or anus. We're joined now by Sara Bastaki, the president of the Emirates Society of Colon and Rectal Surgery. And Sara, thank you for being with us today. I really do appreciate your time and your insights on this, and any questions that you have at home or in the car, get in touch. Sara, you recently held Congress on this topic. What were some of the key learnings or announcements that came out of those conversations?
So thank you, first of all. Thank you for giving me the opportunity to talk in your channel.
You're very
it
welcome.
was actually last week, it was the first Emirates International Colorectal Congress was held. And the thing is, the aim for this Congress was to bring all the expertise around the world, regional, national, and international, to collaborate and to actually share their experience in colorectal surgery. So we can upscale our current surgeons in UAE to other level and tune them up for colorectal surgery. I actually held it in this month, as you said. It's Colorectal Awareness Month. Colorectal Cancer Awareness Month. So it is also we got in this Congress stomach care and awareness sessions for public, so they can get really involved regarding how to get awareness and prevention from colorectal cancer.
Well, we're really honoured to have you today, Doctor, so thank you for this. I wondered if you could share a little bit about how detection for these cancers have changed in the last few years. Can you talk to us a little bit about screenings and awareness around that?
Okay. I just wanted to tell you that United Arab Emirates is the first country in the world who started screening cancer, colorectal cancer at the age of 40. And why is that? Because recent years showed that young age, they are getting colon cancer, and we are not aware what was the reason. Is it genetics, or is it unhealthy lifestyle? Is it diet, unhealthy diet? So it can be one of the reasons, and sometimes it can be with no reason. So we started this initiative at the age of 40 to do colon cancer screening, which is actually you do a colonoscopy, or you do something called a FIT test, which is a stool sample test, which is a very simple test. You do it at home even sometimes.
And I think what we should really emphasise, and I always try and do this when we're talking about detection, and whether that is lung screenings we were just talking about there with Dr. James, whether it is going to see a psychiatrist, as we were talking earlier with Dr. Zishan about ADHD, doctors such as yourself and many across all different parts of the body, this is the day-to-day normal. There is no embarrassment, there's no stigma, there's no taboo to that. And I think it's so important that if embarrassment is a factor of you getting the help or putting your mind at ease, please try to put that aside. And I do worry for a lot of people that this is what's stopping them from getting the help and the early detection that they might need. Is this something you've come across as an obstacle, Dr. Sara?
Yeah. Yes, it is. But I think now people are more aware about cancers and colorectal cancer. So, for example, I'm a female colorectal surgeon, and surgery is actually, if you can say, it's a dominant, previously it was dominant for male more than female, but nowadays I can even see female surgeons are coming into the market more than even they are more interested to do that. So now having more female surgeons, it's very nice to have female patients to be visiting female surgeons.
Absolutely.
So I was lacking that in the previous years, but now because we are getting more female surgeons, more female patients are approaching us to do screening programs, even like mammogram and ultrasound for breast cancer. Now we are going to have it as for colon cancer screening program. Regarding if they are embarrassed, usually, this I can say now it is very minimal because everyone wants to have prevention more than cure. So people are getting more educated, and of course awareness will help more to shed off this embarrassment issue for some patients. So
Thank you.
awareness is I always encourage awareness in everything, not just colon cancer, and breast cancer, lung cancer, and others also.
Dr. Sara, I wanted to ask you a little bit about some of the latest developments when it comes to treatment, especially robotic surgeries. This was a hot topic at the Congress recently. Can you explain a little bit about what that can look like in practice?
The thing is about robotic surgery. First of all, you have to be aware that it's not the whole thing robotic do it. No, it's surgeon controls the robotic. So a human surgeon is very necessary to do that. About robotic surgery, the positive point about it, of course, length of stay. You will have, if there is an uncomplicated, a straightforward case done robotically, the patient can be discharged within 1 or 2 days instead of 4 to 5 days or 3 to 4 days. This is first thing. The incisions are smaller, less infection, and most important thing that you can go as much as deep in the planes, especially if there is a rectal cancer. And as you're aware, rectal cancer are very low cancer, and the pelvic bones are very deep. So robotic, when you use robotic as a tool, you can reach to that plane, and you can do a clean surgery robotically without any complications. So robotic is something I really encourage that the facilities to have a robotic with a robotic surgeon in-house to do those kind of difficult cases.
I'd love to come back to colorectal cancer in general, and it's something that unfortunately my dad's had twice, and I would say he's celebrating his 75th birthday today and is in absolutely great health. Happy birthday, Big Dave. Thank you. But I wanted to ask them, what role do genetics play, and what are some of the risk factors that people do need to be aware of when it comes to colorectal cancer in general?
Let me give you an example. So, for example, if a patient came to me, and I ask always, history taking is very important. In any patient, you're taking a story of a patient. So I always ask family history. So if a patient comes to me and she says that my sister passed away because of, or diagnosed colon cancer at age of 40. So usually, as per the guidelines, you have to do a screening 10 years earlier because we want to know what is the genetic factor here is going on. So it's very important to ask histories. Yeah, genetics plays a big role. And we have a lot of young patients who's coming. I just recently operated on a patient who is only 39 years old with a colon cancer, and they are actually aggressive. So it's very important to know the symptoms like PR bleeding. Someone is having bleeding post-defecation, should be evaluated. Is it cancer? Is it hemorrhoids? It can be evaluated. This is first thing. Second thing, abdominal pain, unnecessary weight loss, loss of appetite. They should come to the hospital, to the clinic, and we can do minimal investigations to maximum taken to just to find out the right diagnosis. It can be nothing. So it's very important the patient should be aware. And the thing is about genetic here in our country, we are now doing the genetic studies because and because we want to know why people are getting colon cancer in early age than in Europe, for example. So this is very important. We are doing all this study and researches, and inshallah, it will be the most important thing that to do screening in early age. This was one of the biggest steps that we did, and just as I said, we're the first of the countries that we started to do screening program at the age of 40.
And lastly, Dr. Sara, apart from being proactive around screening and educating yourself, for everyone listening today, if you could try something, change something, eat something, avoid something to maintain good colorectal health, what would you encourage everyone listening today to do?
Okay. First of all, hydration is very important. So we're like water content of the body is 70%. So hydration is there. So I always advise to drink at least 2 liters to 3 liters if you're active enough of water per day. This is first thing. And to have lots of green in your food. So start your food with salads and fibers. Try to avoid junk food as much as you can. So McDonald's, fried food that can cause indigestion. Try to avoid all this. Have a high fiber diet. And the most important, above all the things, to exercise. Even half an hour in a day is very important. Even walking, like fast walking, half an hour a day or 45 minutes is important to maintain a healthy lifestyle.
Dr. Sara, thank you so much for your time today. Really do appreciate it. Really
Very,
key to
very
raise
much.
awareness, every month, but especially this month as we do mark the awareness of colorectal cancer. Dr. Sara Bastaki, the president there of the Emirates Society of Colon and Rectal Surgery. Always an absolute pleasure to be speaking to masters of their field and find out a little bit more about what's going on. And equally, if there are any conditions or challenges that you think we should be talking about here on Dubai Eye 103.8, get in touch with us. Let me know on 4001.
This content is for informational purposes only. If you would like to seek medical treatment, please contact a certified healthcare provider for personalised advice and diagnosis.
And thank you for downloading this episode of the Afternoons with Helen Farmer podcast. Don't forget, you can subscribe. You'll get direct to your phone as soon as it's out. And you can listen to me live on Dubai Eye 103.8, Monday to Friday between 2 and 5 p.m.
You've been listening to a Dubai Eye 103.8 podcast. To enjoy lots more from Dubai Eye in the United Arab Emirates, just go to DubaiEye1038.com or find them wherever you normally get your podcasts.